Ultimately decided there's going to be three lectures with lecture 12-2. So we're going to talk a little bit about hormones. And this is going to be kind of general. Like I mentioned in the last video, hormones, the endocrine system is tricky, I guess, just because there's so many interactions and it's so multifactorial. So we're going to just talk about just really broadly some of the hormonal adaptations and the benefits of these adaptations. And really what I'm doing is I'm going through 4 or 5 hormones, and we're just going to talk about what they do. All right, so when we exercise, we release more testosterone, but this doesn't last for very long. Okay, and so after we're done exercising, these testosterone values go back to normal. So what happens when we train? Well, it doesn't seem to affect resting conditions. However, those of us, such as myself, who are aerobically trained, we seem to have maybe slightly higher concentrations, lower concentrations, resistance training. That makes more sense. So those people that have resistance training appear to have greater concentrations during exercise than those of us that are aerobically trained. And the benefit or the reason that we want this testosterone is that it appears linked, at the very minimum, linked to the nervous system and helping with the adaptations that are needed for the nervous system. So we talked about last time how initial changes in strength actually come from the nervous system and increased neural drive as opposed to actual changes to the muscle. Then we've got growth hormone, and this is one where there's a lot of unknowns because it's not like there's just one type of growth hormone. There's multiple types, there's several different growth hormones, and there's several different receptor types, and so that can make studying growth hormone challenging. So what we do know is that during acute exercise, growth hormone concentrations increased. It appears that growth hormone is correlated with lactate concentration, so the higher the intensity, the more lactates in the blood. We'll also have high levels of growth hormone. But shortly after exercise is done, growth hormone concentrations go back to normal. All right. Training, just like with testosterone, doesn't seem to really affect resting concentrations. But when we acutely exercise after training, we're going to release more growth hormone. And this makes sense, especially since it's correlated with fiber hypertrophy, right? So if we're stressing these muscles, we want these muscles to grow and adapt, and growth hormone appears to help with that. Then we've got insulin-like growth factor, okay, or IGF. And so this is something that stimulates growth in most cells. Now, it's called insulin-like, not because it does what insulin does, but I believe because the structure is similar to that of insulin. Having said that, during acute exercise, there is a delayed response to the release of IGF, and it appears that the amount of IGF that's released is dependent on the amount of growth hormone that's released. Now, after training, this shouldn't be a shocker. It's like the other hormones we've talked about. There's no effect on resting concentrations. But like growth hormone, it's difficult to study because it interacts with other hormones. And so we get these interaction effects that make it difficult to parse out exactly what insulin-like growth factor does and or to what extent it has an effect. Next, we have cortisol. We all know about cortisol. It's a stress hormone. So when we exercise, because we're putting our bodies under stress, we release more cortisol. It's also correlated with lactate concentration. And once exercise is over, cortisol concentrations go back to normal, which shouldn't be surprising because we've eliminated the stress. Exercise is the stress. You stop exercising, the stress is gone. So even though this is a stress hormone, it doesn't seem to be affected by training. Okay, so there's a common theme here. And then finally, we've got epinephrine and norepinephrine. So when we exercise, we release more of both of these hormones. This is something that you should have known, that you should know from not only this class, but 220 or your physiology class, right? So when we exercise, that's going to increase blood pressure, which we accomplish via heart rate, stroke volume, and resistance. And the way those variables are increased is due to a release of epi and norepi. All right, just like all the others. Epinephrine and norepinephrine training does not have any effect on resting concentrations. However, the more we train, the more we release during maximal exercise. That shouldn't be too surprising because, at least in my mind, when we train, we're able to exercise harder, faster, stronger, that sort of thing. And so I'm going to need more of that to increase blood pressure, heart rate, stroke volume, all of those things. Epi and norepi are one of the first hormones to be released during exercise, and these hormones appear to affect all of the others with the exception of cortisol that we've talked about. And so with that, that is our very brief overview of resistance training and hormones.